This video has been endorsed by the Royal Australian College of General Practitioners. It's been produced by Business Essentials with the assistance of the Heart Research Centre. The Why Me series of videos has been generously supported by Main Health, Australia's largest private healthcare network, and Australian Unity, the health fund with Well Plan, a series of better health programs designed to keep you healthy.
I've always been interested in sport, sailing in the younger days, running. I've always been a runner. You know, why does it happen to a fit person? It can. You've got to believe it. Why me? Why was it?
Why you? Well, we're here to explain how it happens and what it all means. At least we've identified the potential danger and can start helping you to do something about it. So let's take a closer look at this most vital organ, the heart. The heart is a muscle that pumps blood throughout our body. It's the central part of the cardiovascular system through which your blood circulates constantly. This circulation process distributes oxygen, nutrients and chemicals to all the cells of the body, and it helps remove waste products from the body's cells. The heart is a strong, hollow organ made of muscle and the size of a clenched fist. It sits between the lungs in the centre of the chest and is protected by the breastbone, the ribs and the spine. Arteries carry blood from the heart and veins bring the blood back. The veins, which are like a low-pressure drainage system, bring blood from around the body to the right side of the heart. The heart then pumps this blood to our lungs. There it gets a fresh supply of oxygen. The stronger left side of the heart takes the oxygen-refreshed blood out of the lungs and pumps it back around our body. It travels along the arteries, which are like a high-pressure irrigation system. Each circulation of blood around the body takes about 23 seconds, and in an adult, that circulatory network of arteries, veins and capillaries, end on, is equivalent in length to 2.5 times around the Earth's equator. The main pumping chamber of the heart is a muscular bag called the left ventricle that pumps the blood into a large blood vessel, the aorta. This main blood vessel carries blood under high pressure with branches that reach all parts of the body. Because the heart is a working muscle, it also needs blood to keep it healthy and working well. So the first branches from the main blood vessel, the aorta, run back across the surface of the heart, and branches also pass back into the heart muscle itself. These branches, or arteries, form a crown around the heart and so are called coronary arteries. The three main artery diseases are heart attack, angina and stroke. If our diet includes too much fat, the amount of cholesterol in our blood increases. Saturated fats are the main thing that raises the level of blood cholesterol. They are generally found in animal fats like meat fat, the skin on poultry, full cream dairy products, many takeaway foods and processed foods such as pastries, cakes and biscuits. 2 vegetable oils, coconut and palm oil, are high in saturated fat. Cholesterol contains a bad element that gets deposited on the inside walls of our arteries. A fatty lining or plaque builds up inside the arteries and the arteries narrow or clog up, and so the flow of blood is reduced. This can happen in all the arteries, but it usually occurs at bends and divisions in the arteries, and it particularly occurs in the coronary arteries that carry the blood to the heart muscle. The process that clogs arteries in this way often begins in childhood. A diet that contains too much of the bad fat and smoking and high blood pressure can speed up the development of this condition. Narrowing of the coronary arteries develops slowly over the years and in time may prevent a full flow of blood down the coronary arteries. Then you can develop temporary pain in the chest or discomfort. The pain can also occur in the neck or arms and even in your hands. This pain is called angina. It occurs because some part or parts of the heart temporarily are not getting enough blood and oxygen. It often occurs when you exercise and is eased by rest. Angina is not a heart attack and the heart muscle is not permanently damaged. However, a history of angina indicates a higher risk of heart attack in the future, and untreated angina obviously will interfere with an active lifestyle. Angina can be treated with lifestyle changes, medication and sometimes surgery, but the clogging of your arteries usually continues. However, lowering of cholesterol levels through lifestyle changes, along with certain medications, may slow the clogging and even reverse it. To manage your angina, you have to stop smoking because it causes blood clotting in arteries, reduces the amount of oxygen in your blood, and increases the build-up of plaque. You need to exercise regularly and eat less fat and salt. The usual medications for angina are nitrates that come in tablet or spray form. They're absorbed through the lining of the mouth. The most commonly used is nitroglycerin, mostly called anginine. If you feel an attack coming on, you may be able to prevent it by chewing or slowly dissolving an anginine tablet in your mouth, usually under the tongue, or using the spray. The same medication is used to stop an attack. Alternatively, Isodil or other nitrate tablets may be prescribed. They're also dissolved in the mouth. As well, an oral form of Isodil and another drug in tablet form, Imdur, are used to control angina symptoms on a longer-term basis. Special nitroglycerin patches also are available. The medication they contain is absorbed through the skin. These medications increase the flow of blood and reduce the heart's workload. A range of drugs taken regularly can help to reduce how often you get angina and how severe it is. There are other medications for angina that reduce the heart's oxygen needs. Beta blockers reduce angina by easing the workload on your heart. However, there are side effects, including making asthma much worse. Calcium channel blockers work in several ways. They widen narrow arteries and affect the chemical activity of the heart muscle cells. Beta blockers and calcium channel blockers also lower blood pressure and are helpful for people with angina and high blood pressure. Another range of drugs called ACE inhibitors is also used in the treatment of high blood pressure and the aftermath of a heart attack. Your doctor will work out the best drug or combination of drugs for you.
I believe I was very outgoing. I've always, from a young person's age, I've been interested in sport, particularly sailing in the younger days. Running, I've always been a runner. One particular occasion, for another reason, I went to my local GP. While I was there, I said, look, when I'm running, I just get pain in my upper left shoulder there. I said, some people say you've got a heart condition when you got that. And I said, it's worthwhile investigating. We did an ECG and the cardiologist said, you've got heart disease. You've got a fully blocked left coronary artery. And he said, that's a fatal situation. In this case, it's a triple heart bypass. Why me? Why was it? You know, why does it happen to a fit person? It can. You've got to believe it. The procedures for heart surgery is probably not that much different in terms of the way you approach it personally yourself. I really didn't have any major downside to my surgery. I was a little uncomfortable at night time because of my chest wound. My advice to a person having undergone heart surgery or in the prospect of having to undertake it is be positive, trust the surgeons, they'll do the right thing for you, and you just watch your own physical condition and your diet. Make sure you keep up plenty of exercise.
Sometimes a coronary artery becomes blocked and that causes a heart attack. It causes a heart attack because it affects the heart muscle supplied by that blood vessel. Well, a portion of the heart muscle, which is normally supplied by this blocked blood vessel, becomes damaged and some of it may die. That means that that you get pain because of the deprivation of blood supply, but also the damage to the heart means that it doesn't function as well and slowly you develop complications due to the blockage.
A change in the coronary artery is usually caused by a change in the plaque or where the wall of the artery has narrowed. The plaque may develop a small crack on its surface and blood clots on the surface at that point in the artery. The clot severely reduces or stops the blood supply to the heart. The blood clot is called a thrombus, so a heart attack caused by a blood clot in a coronary artery is called a coronary thrombosis. If the blood clot blocks or occludes the artery, it is called a coronary occlusion. When a coronary artery is blocked, a part of the heart muscle receives little or no blood for a time. It becomes permanently damaged or dies. This is called an acute myocardial infarction, a true heart attack. If there is very large damage to the heart muscle, it may stop pumping altogether, resulting in death. The terms coronary occlusion, coronary thrombosis, acute myocardial infarction and heart attack are often interchanged. After a heart attack has occurred, the dead muscle shrinks and is replaced by a scar. New blood vessels open up to carry blood to the area near the site of the damage. The heart muscle nearby thickens to overcome the weakness in the area of the heart attack. Recovery occurs over a few weeks. By now, the heart attack is a thing of the past, but you are left with a scar in place of good functioning muscle, and you still have the underlying coronary heart disease that caused the heart attack. A stroke occurs when a blood vessel that supplies the brain becomes blocked or bursts. The blood flow to the brain suddenly stops and a part of the brain is starved of oxygen. Brain cells are damaged, causing paralysis, usually down one side of the body, difficulty in speaking and swallowing, or difficulty in thinking or understanding. A stroke is sometimes called a brain attack and is caused in a similar way to a heart attack. Stroke can cause death. It strikes suddenly and often without warning. Congestive heart failure occurs when the heart is weakened because of disease or damage. The most common causes are high blood pressure and coronary heart disease. The heart is forced to work too hard, but it can't pump blood at a normal rate. Fluid may then back up into other organs, especially the lungs and kidneys. There may also be liver congestion and swelling in other parts of the body, including the legs and ankles. Congestive heart failure is managed by medication, diet and lifestyle changes. Your doctor will prescribe medication that relaxes blood vessels and lowers your blood pressure. The heart then can pump more blood without extra effort. Fluid pills may also be prescribed to help get rid of excess water in the body, again making it easy for the heart to pump blood. Another medication that may be used helps your heart to pump more strongly. Because the heart muscle has more strength, it pumps more blood with each beat. Stopping or taking more or less of the medication as prescribed by your doctor can be dangerous. There are numerous routine surgical procedures that are used to respond to cardiovascular disease and counter its impact on the individual patient. Surgery is most common for angina, to bypass damaged arteries. Surgery on the arteries in the neck may be considered in the case of stroke, but operations in and around the brain are complex and can have higher risks for the patient than does heart disease surgery. However, medical science is constantly refining and improving existing techniques, as well as developing new techniques that improve the prospects of surgery that helps the patient's recovery. In most cases of heart disease, you'll be advised first to undergo what is called a coronary angiogram or coronary arteriography. Big words for what is a relatively simple procedure to check the seriousness and extent of the clogging of your coronary arteries. This procedure involves introducing a thin plastic tube called a catheter into an artery in your groin or arm. A local anaesthetic ensures that you have no pain, and you can actually watch the procedure on a monitor as it happens. Once the catheter reaches the heart, a special liquid dye is injected. You may feel a warm flush as the dye is injected. The dye is visible on X-rays. This allows the medical team to see the condition of your coronary arteries, those that surround and feed the heart itself. This view of your arteries shows your heart specialist just how extensively your coronary arteries are clogged and how much the blood flow is being restricted. The angiogram looks at the left ventricle of your heart. Remember, that's the main pumping chamber. This tells the cardiac specialist how well your heart is pumping. The procedure also can show narrowing or occlusion of the arteries and the functioning of the valves and muscular walls of the heart. Armed with this information and other tests that will be made, your doctor or specialist will tell you what medicines and surgical procedures can help your specific condition. After an angiogram, you'll have to lie still for up to 4 hours to ensure that small hole in the artery where the catheter was inserted has closed over. Often this procedure involves 1, sometimes 2 nights in hospital. A common procedure to counter badly blocked arteries is called angioplasty. This involves using a catheter to insert a special balloon into the artery at the point of blockage. The balloon is inflated and deflated to compress the plaque against the arterial wall. This procedure opens up the narrow or blocked artery, improving the flow of blood to the heart. Sometimes the cardiac specialist discovers a serious and potentially dangerous blockage in your coronary arteries when the angiogram is carried out. If this happens, angioplasty often will be done immediately to reduce the risk of a heart attack. Another device is used to keep the clogged artery open after the balloon has been inserted. An expandable metal tube, such as a coil or wire mesh and called a stent, is placed at the same site as the balloon. Again, this is done using a catheter. Once it is expanded, the stent keeps open the previously blocked or clogged artery. The lining of the artery grows over the stent, which then becomes part of the arterial wall. Angioplasty generally requires only a short stay in hospital. It's important to know, however, that in some people the damaged artery may narrow again within a few months. If this happens, you may need to have a repeat angioplasty or stent procedure. Yet another way to counter the effects of plaque that is blocking an artery or arteries again involves using a catheter that reaches to the problem site. In this procedure, it carries a balloon to anchor the catheter in position. A rotating blade at the tip of the catheter then shaves the hard plaque inside the artery into microfine particles. These plaque shavings are saved in the nose cone of the catheter and are removed from the body when the catheter is withdrawn.
People need bypass surgery for two reasons. The commonest is that they have angina, that is discomfort, pain, strangling, tightness in the chest, and that's not readily necessarily relieved by medication. It constitutes disability, and therefore bypass is performed to bypass the blockages or to bypass major narrowings in the coronary arteries. That improves the blood supply to the heart muscle. That leads to disappearance of the pain, removal of the disability, opportunity to resume normal life and be well.
Coronary artery bypass surgery, or coronary artery bypass graft surgery, is just what it says. In this operation, the cardiac surgeon borrows blood vessels from other parts of your body. Mostly these days, bypass surgery uses an artery or arteries from inside the chest. These arteries, located in the chest wall, carry blood to the muscles between the ribs and other tissue in the front of the chest. They can be separated from the chest wall and then sewn or grafted onto the coronary artery below the area that is narrowed or obstructed. So the blockage in your artery is bypassed and the blood again can flow freely to the heart muscle. Sometimes for a bypass operation, a piece of a long vein is removed from your leg or an artery is taken from your arm. Grafts using veins from the legs may narrow or become blocked during the next 10 years, some earlier, some later, some never. Artery grafts from the forearm probably last longer. Artery grafts from inside the chest are unlikely to narrow or become blocked within 15 or 20 years from the time they're put in place. After you have recovered from your operation, you should be fit and well and able to resume all activities. What is commonly known as a heart-lung machine is almost always used for coronary bypass graft operations. Your heart is stopped and your blood is pumped through an oxygenator or heart-lung machine, replacing your breathing and blood circulation while the bypass is carried out. Many thousands of Australians have bypass surgery each year, an operation that is considered to be both safe and successful. The first few days after a bypass operation may be painful and you may feel weak. You'll have a period of pain, particularly in the front of the chest. This is because your breastbone has been cut through and then wired together to hold in place so you may breathe normally after the operation. You'll probably find your sleep is disturbed, movement is difficult, and coughing is painful. You'll receive considerable attention that you may find irritating and unpleasant. You'll be encouraged to cough when you don't want to. You'll be encouraged to do movements and exercises that will hurt at first. However, the pain can be eased in various ways, and the physiotherapy and nursing staff will show you how to do this. You may get other problems after bypass surgery, such as a burning or loss of sensation in the front of the chest that can last for weeks or months. For a few days, you may have pain when you breathe that's caused by inflammation around the heart because of a build-up of blood after the operation. Other after effects may include muscular and joint pain and soreness, leg soreness, swelling and irregular heartbeat. These will settle down within hours or days. You may feel frustrated, unhappy and even angry, but usually the day after you feel this way, most people will feel well and start to look forward to going home. and the future. There are other forms of bypass surgery which are called minimally invasive heart surgery that involve making small holes or ports in your chest to reach the coronary artery or arteries that need to be bypassed. Instruments are passed through these ports into the site of the bypass. In one version of this surgery, the cardiac surgeon uses video monitors to observe the procedure inside your body. This version of the procedure involves the use of a heart-lung machine, and your heart is stopped while the operation is performed. A similar form of minimally invasive coronary artery bypass is also done through ports in the chest, but with the heart still beating. Usually an artery from inside the chest is used for this bypass procedure, but in this case the surgeon is able to directly see the grafting process. This version of bypass surgery is used mainly when there are only one or two arteries that need to be bypassed. There are valves in your heart that control the direction blood flows in the chambers of your heart. They can be damaged by infection, disease, or you may have been born with the damage. Sometimes a valve will allow reverse blood flow. Sometimes a valve will not open fully and restricts the flow of blood. Damaged or malfunctioning valves usually can be repaired or replaced. Several types of replacement valves are used. Tissue valves usually come from an animal donor, the most common sources being pigs. Mechanical valves are made of metal or plastic.
People need transplants because their heart cannot pump adequately. It's been very much damaged either by past infection, virus infection, or recurrent heart attacks, so that you have a poor, floppy sort of heart that can hardly contract enough, in consequence of which fluid dams back into the lungs and the patient has congestive heart failure. So they're breathless even at rest. And in those people, transplantation is really the only way out unless you can control it by medical treatment. Often medical treatment, modern pharmaceutical intervention, is effective in controlling it and even reducing it and improving the patients. If that fails, then they're candidates for transplantation.
This involves removing the diseased heart and replacing it with a healthy human heart from an organ donor who has recently died. There's a narrow time frame in which to get the donor heart to the patient and complete the transplant. This is a major operation, but around 70% of patients survive for several years of extra living. After heart surgery, you'll spend time in a critical care unit where your recovery will be closely monitored. Your nurse will help keep your mouth cleared and help you to turn, cough and breathe deeply. Your pain will be managed with appropriate medication. You should be able to sit on the side of the bed a day after surgery and on a chair the first and second day after your operation. Once your breathing tube is removed, you'll need to perform coughing and breathing exercises to expand your lungs and avoid chest infections. These exercises need to be done frequently because it is essential that you keep your lungs well expanded after your surgery. After 1 or 2 days, you'll be able to go to another ward where you'll increase your activity rate. A physiotherapist will work with you on an activity program tailored to your particular state of health. Monitoring machines will closely check your heart's reactions to activity and exercise during this period. You've just been through very considerable physical and emotional stress. Understandably, you'll have worried and may still be worried about the operation itself and your prospects for the future. You've had high stress and relatively unfamiliar surgical treatment. There's been a massive information about your operation and often many unfamiliar words and descriptions. It may have been hard to take it all in. Sometimes because you've been drowsy or uncomfortable, you haven't been able to concentrate on what you're being told, or your mind was on other things. You may be anxious and insecure about your recovery, possible disability, the operation failing, or possible heart problems recurring. Unsuccessful surgery is quite rare, although occasionally some people find their angina is relieved, but they suffer from shortness of breath or some other problem. These chances are small, but it is not unreasonable for you to worry.
I've built my life over the last 5 years based around heart attacks. I found that I was starting to get some pains through my hands, into my arms and down the back of my spine. I spoke to my inner self and said, this is not right, let's get out of here, let's get up to the hospital and find out what's going on. Doctor raced in and said to me, Mr Huntington, you're not having an angina attack, you're actually having a heart attack. I seen a specialist the next couple of mornings and finally caught up with my now long-time cardiologist. Tony soon discovered that I had a blocked artery. What he then did was he did an angioplasty where the machine that he's got also has a balloon on it and, for the want of a simple explanation, pushes all the rubbish out to the side and virtually jackhammers it out to the edge. If that's going to work, it will last for a long time. If it's not going to work, it will last approximately 3 months. Exactly 3 months to the day later, I got a pain. Instantly this time, I knew what it was. Uh-oh, I've got it back again. What Tony decided was to put a stent in. He has put a spring and wedged it across the artery. So as if it started to want to go back in again, it wouldn't. And to this day, that stent is still inside that artery, inside my heart, and still working in perfect condition. I guess the major change has been the weight. I tipped the beams at about 121 kilos, so we're very much more conscious about how we eat. The one thing that I am absolutely positive of is that it's not the end. If you're fortunate enough you've been given a second chance, make the most of it, because every day in this life is so important.
Your rehabilitation will be based on a detailed program that's designed to fit your special physical circumstances and needs. These programs aim to provide patients and their families with education, information, physical activity and support. International and national health bodies recommend that every patient who has had a heart attack, heart surgery, coronary angioplasty or other heart or blood vessel disease should routinely be referred to an appropriate cardiac rehabilitation and secondary prevention program. Usually there are education and counselling sessions during convalescence. It's important for your spouse or partner to be with you as much as possible during this time. They will have an important support role to play once you're at home, so they also need to receive information and advice from your medical team. They need to know about your heart condition and the problems that patients have after their operations, such as why you may be irritable at times. Your spouse or partner may be better able to ask many of the questions that need answers on your behalf, while you concentrate on your recovery. Spouses or partners usually have their own concerns. Commonly, they have conflicting feelings about the patient's illness, including anxiety, guilt, and anger. Marital disagreements are common during convalescence. There may also be considerable disagreement about your recovery program, especially about diet, activity levels, driving the car, sexual activity, or work. If you do not have a partner or family, you should consider joining a support group that can supply you with information and encouragement during your rehabilitation period. Making a good recovery is up to you, your doctor, and your rehabilitation team. There is a common sense tick list for keeping your recovery on track and maintaining a healthy lifestyle in the years to come. Remember, after your acute cardiac illness is treated, you still have the underlying disease. That can be reversed or controlled by continued good health behaviours and by medication. You need to always take medications exactly as your doctor prescribes. Take your medicines regularly. It is important to take your medications even when you feel well. So avoid missing out on doses and don't double up if you should forget. Do not take other drugs such as non-prescription drugs without checking with your doctor. Most people take aspirin for coronary heart disease and continue to take it in small doses for the rest of their lives. Aspirin helps to prevent blood clotting, which means you are much less likely to have subsequent episodes of artery narrowing or blockages. However, aspirin should be avoided if you have internal ulcers, if you're allergic to it, or unable to tolerate it. Diuretic drugs may be prescribed to control your blood pressure both before and after your operation. ACE inhibitors, beta blockers and calcium channel blockers may be prescribed to control or lower your blood pressure. These will probably be needed for the rest of your life. Remember though that beta blockers can make asthma worse. Cholesterol-lowering drugs may also feature in your list of medications. It is essential that you keep your cholesterol level down. Digoxin is commonly used to control palpitations or irregular heartbeat. You may only need to take it for some weeks or months. It may be used on a long-term basis, however, to control your pulse rate if there is a permanent irregularity or if you've had past heart attacks. Your doctor will advise you about side effects of these medications. Smoking reduces the amount of oxygen in your blood, starving the heart and the rest of the body of correct nourishment. It also damages and weakens the artery walls. Stopping smoking is the single most important thing you can do to reduce the risk of further coronary disease. You can help lower your cholesterol level and limit further artery clogging if you reduce the amount of saturated fats in your diet. Eat low-fat dairy products instead of full cream dairy products. Use lean meat or remove any fat. Avoid products that contain coconut oil and palm oil, most fried takeaway foods and commercially baked products. Eat fresh or tinned fish 2 or 3 times a week. Steam or grill food instead of frying or baking in oil. Eat bread, especially wholemeal or grain. Prefer whole grain cereals for breakfast rather than bacon and eggs. Eat plenty of fruit, vegetables and salads. Vegetables that are good include broccoli, Brussels sprouts, cauliflower, cabbage and leafy vegetables like spinach and silver beet. And avoid salt.
Food, glorious food. Doesn't it look fantastic? We have amazing food on this planet to take advantage of. But it's interesting, the healthy foods we're not eating too much of. Why is that? I often think it is because on Monday, when we do the Monday thing, on Monday I'm going to start being good and start eating good foods. You start off by steaming vegetables. You cut out any fats or oils or foods that actually lubricate and make plant foods taste good. So I've got some foods here that are very simple foods. They're not too wacky. Some people are a bit shy about sushi. It has great flavor, but for some people it requires getting used to it. With sandwiches, make sure you've got wonderful breads that have chewy kind of flavor to them and put lots of vegetables in them. Make them full of life. If you want to put butter on it, use avocado. It's nature's butter. It's fantastic flavor in it. It's nutrient dense. Soups are another way of actually introducing lots of plant foods into your diet and making them interesting. There are things like Vietnamese rice paper rolls that you can put all kinds of herbs and vegetables into and a nice clean dipping sauce. And if you feel like something very filling or something that's, home comfort foods, you can have a tart, but fill the tart shell with beautiful roasted vegetables and maybe a bit of feta cheese. Another alternative to get a bit more fiber and flavor and texture into your diet is when you're using rice, try brown rice. It's different, so it requires getting used to it, but it has a wonderful flavor once you get used to it. Berries in season, take advantage of them. They are expensive, but they're worth every dollar that you spend on them. Of course, the best piece of advice I can give you about increasing plant food consumption is to buy it well. Buy it fresh. Limp, flagging vegetables are no bargain at the bargain table. Buying organic and biodynamic and just vegetables in season at their peak is the best tip for actually enjoying plant foods. And then you have to do very little to them to make them taste sensational. So get out there and eat all the wonderful plant foods that you can. Make it taste good, enjoy it, and even though you spend a little bit extra on your veggie bill, it will pay for itself in your health.
Your rehabilitation program will suggest what activities are best for you. Walking is always good. Regular moderate activity is better than overdoing it. You should build up the level of your activity gradually with advice from your rehabilitation team doctor. Physical activity helps control key risk factors, including blood pressure and weight. And regular physical activity can make you feel more confident, happy and relaxed. High blood pressure strains your heart and can speed up the development of coronary heart disease. Have your blood pressure checked regularly. If it is high, reduce your salt intake, limit daily alcohol intake to 2 drinks or fewer, and get your doctor's advice. Your medication helps manage high blood pressure. If you need to, lose weight to reduce another risk factor of heart disease. A healthy diet and being active helps get your weight down. Your doctor can also advise on how to reduce your waist measurement.
Hi. Now we all probably know and have heard that physical activity is the best way of feeling good. But I'm not talking you have to go to the gym and pump iron or do frantic aerobics. But what I am saying is that you can increase your activity without having to plan dress the part or drive somewhere, because the fun starts in your own home. The first step is really simple. Put away all your remote controls. Labour-saving devices such as these have all made us a little lazy and less fit. Think of other things you can do to rediscover physical activity. Even vacuuming can be an aerobic activity. Try hard and it may even be fun. A lot of people hate stairs, but look on the bright side. Each step you take is a tiny little aerobic and weight-bearing activity. Instead of trying to carry a heap of stuff in one trip, do more trips. It'll be safer too. If you've been sitting around for some time, do a couple of stretches like this, and then go for a walk. This applies at work too. Gardening is another activity we sacrificed. Did you know some people actually pay someone else to dig their weeds and mow their lawns while they go to the gym? What a waste of money and opportunity. Walk more. Take a few minutes and walk to the corner shop rather than drive. Post a few letters while you're out, and instead of going back the same way, take a different route. If you do have to drive somewhere, don't waste time looking for the closest parking spot. Park a few hundred metres away and enjoy a brisk walk. Visit your local park. They're there for our enjoyment, so why not make the most of them? Walk a couple of laps to count the trees, and picking up the odd piece of litter is a great community and physical action. It's not difficult to increase your level of activity. In Australia, we're blessed with the perfect range of climates for any activity, as long as you're sun smart. Our councils and governments have done their bit too by creating beautiful walks, bike paths and parks. These are everyday activities. It would be useful to do more exercise, but for that you should seek advice from your GP or a physiotherapist. So start now. When you've finished watching this program, get up and turn the TV off, hide the remote and take a few steps further. Look for every opportunity to increase your physical activity. Think of it as an investment in your health. Good luck and good health.
A common sense approach to caring for your heart offers an improved lifestyle. There is excellent support for everyone with heart disease before and after surgery. Booklets and leaflets are available on every aspect of coronary heart disease, management and treatment. Counselling is readily available. The Heart Research Centre conducts valuable research into the prevention of heart disease and into cardiac rehabilitation. Look after your heart, look after your life. Take care.
She can now be sure her smear test will be more accurate than ever before. By the use of keyhole surgery, he may avoid the trauma of open heart surgery. As Australia's largest private healthcare network, we are committed to linking medical professionals with the best technologies and the best facilities to provide Australians with the very best healthcare imaginable.
That's the main difference.
Australian Unity would like to introduce a real innovation in health cover, one that offers prevention, not just cure. WellPlan is a series of better health programs designed to help keep you out of places like this. So, if you'd like a little extra preventative care, tailored for you at no extra cost, talk to Australian Unity. They're with you in sickness and now in health. So, who's looking after you?
WellPlan includes a personalised health assessment program, internet-based fitness, nutrition and well-being programs tailored for the individual, preventive no-gap dental services at no out-of-pocket cost, rebates for completing quit smoking programs, rebates for health checks with a doctor of your choice, cover for natural therapies, and a rewards program offering discounts for health-related products and services. WellPlan. It's all about better health for you.
This video has been endorsed by the Royal Australian College of General Practitioners. It's been produced by Business Essentials with the assistance of the Heart Research Centre. The Why Me series of videos has been generously supported by Main Health, Australia's largest private healthcare network, and Australian Unity, the health fund with WellPlan, a series of better health programs designed to keep you healthy.